Hello, my name is Dr. Raj Patel. I'm the Deputy Medical Director for Primary Care for NHS England. I've also been a GP for 25 years, and in my practice I see patients right from the moment they're born up until their final illnesses and their last breath. And it is just an extraordinary privilege to be able to see people through their entire lives and look after their families. Very occasionally I have to refer people to the hospital. If I do refer people to the hospital, sometimes it's for a procedure. If you have to have a procedure in the hospital, there are a number of people you're likely to meet.
I'm Lisa. I work as a staff nurse in the elective orthopaedic preoperative assessment unit, and part of my role is to work with a team of nurses in a nurse-led clinic, and we see patients that are referred for elective orthopaedic surgery. We complete the preoperative assessment, take the medical history from the patients and complete the tests that are then needed. Following the assessment, we then follow up the results and make sure that they're prepared and optimised before surgery.
My name's Des Nelson Barrett. I'm a theatre patient escort. My job is to receive patients, bring them up to the theatre patient reception, where we wait with them, we check all the paperwork, and then after that we wait until they're picked up by an ODP, taken around to theatre for whatever procedure they're going to have.
Hi, my name's Darrell. I'm Theatre Admissions Lounge reception. My first job in the morning is to greet the patients, sit them down, admit them on the computer so that all the details are in ready. Sometimes we take them through to their pods, and then from then we start the procedure of getting tomorrow's list ready and collecting the notes in for that list.
Hi, my name's Ali. I work at the pre-op department. I'm a healthcare assistant, so what I do is I bring the patients through, do their observations, and then if required the nurses will ask me to do their ECG and bloods.
Hi, my name's Lynn Simpson. I'm predominantly work for theatre stores. I also do a speciality coordinator for orthopaedics, which means ordering all the implants required for all the hip operations, knee operations and all the orthopaedic replacements that they do in the neo theatres.
Hello, my name is Lorraine. I'm an orthopaedic nurse practitioner. I work alongside consultants and I see the patient all the way through the patient journey. I'll see them when they're first listed, when they see the consultant for the hip replacement or knee replacement, whatever surgery, and I do a triage on them. And then I'll order any medical tests at that point to make sure that we can get them fit for surgery.
Hello, I'm Andrew Manctelo. I'm an orthopaedic consultant. I work here in Nottingham and I specialise in hip surgery. So I actually carry out the operation, the hip replacement. I see the patients in clinic to decide whether we feel that their symptoms are bad enough for surgery. I talk them through the operation and then I go ahead and perform the operation for them. I look after them on the ward and then make sure they do well once they get home.
Hi, I'm Richard Briley. I'm the workshop manager for estates here at NUH. I work very closely with all the theatre departments and we do the pre-planned maintenance every year. This will involve a predetermined date when the theatre is closed, and I arrange for all the workforce to do all the specific maintenance required. This includes everything from ventilation and heating, working and servicing the air handling units in the plant rooms, to the actual work within the theatre.